Welcome to the final installment of our series on preeclampsia. Having discussed what it is and how it's diagnosed, we will now explore nursing management, the potential complications for both mother and baby, and the important topic of prevention. Nursing management is a cornerstone of care for patients with preeclampsia. It is a hands-on, vigilant process focused on continuous monitoring and patient safety. Nurses play a critical role in frequently assessing the mother's vital signs, especially blood pressure, and monitoring for any new or worsening symptoms. They meticulously track fluid intake and urine output to evaluate kidney function. For patients receiving magnesium sulfate to prevent seizures, nurses perform regular checks for signs of toxicity, such as loss of reflexes, respiratory depression, and decreased alertness. They also continuously monitor the baby's heart rate and activity. Beyond the technical tasks, nurses provide crucial education, helping the patient and her family understand the condition and what to expect. They create a safe, low-stimulus environment by dimming lights and reducing noise to minimize the risk of seizures, while also offering essential emotional support during a stressful time. Despite the best care, preeclampsia can lead to serious complications. For the mother, the most dangerous progression is to eclampsia, which is the onset of seizures. Another life-threatening complication is HELLP syndrome, a severe variant of preeclampsia that affects the blood and liver. HELLP stands for hemolysis, the breakdown of red blood cells, elevated liver enzymes, and low platelet count. Other maternal risks include placental abruption, where the placenta separates from the uterine wall before delivery, as well as stroke, organ damage, and an increased risk of cardiovascular disease later in life. For the baby, the complications are often related to the placenta's inability to provide adequate oxygen and nutrients. This can lead to intrauterine growth restriction, or IUGR, where the baby does not grow at a normal rate. The need for early delivery often results in preterm birth, which carries its own set of risks, including respiratory distress syndrome and other challenges associated with prematurity. This leads us to the crucial question: can preeclampsia be prevented? Currently, there is no certain way to prevent it entirely. However, there are strategies to reduce the risk, particularly for those at high risk. The single most important factor is early and regular prenatal care, which allows for prompt detection and management. For women identified as having a high risk of developing preeclampsia, such as those with a history of the condition or chronic hypertension, healthcare providers often recommend taking a low-dose aspirin daily, starting late in the first trimester. Managing pre-existing conditions like hypertension and diabetes is also vital. Adopting a healthy lifestyle, including maintaining a healthy weight before becoming pregnant and eating a balanced diet, can contribute to a healthier pregnancy overall and may lower the risk. In summary, diligent nursing care is key to managing preeclampsia, while awareness of potential complications underscores the seriousness of the condition. Although prevention isn't guaranteed, risk reduction through early prenatal care and targeted interventions like low-dose aspirin for high-risk individuals offers the best defense.